Hey everybody, just here at my favorite beaver pond in Colorado to talk about clinical studies and how we set up clinical studies for dietary supplement claims. There recently was a warning letter where a company received this letter for actually setting up their clinical study for their dietary supplement to study dementia. When FDA looked at this, they actually considered this a drug study because of the endpoint of dementia requiring an IND or an investigational new drug. Now, when we think about clinical studies and dietary supplements, we know that we can't make claims, disease claims about our products, even if we have all the clinical data in the world. So from a practical business point of view, does it really make sense to study disease endpoints? Because they don't necessarily translate over to compliance. For example, we're not going to study something related to cancer because that doesn't translate into compliant supplement claims. But what about if we're talking about mobility? Perhaps we can find some mobility endpoints. The point here is that when you're putting together your clinical study, you're making an investment. Really think about, of course, the endpoints, because you don't want that to trigger the IND requirement, but you also want to make sure you can use them in marketing, right? We want to substantiate the claims that we make. I'm Asa Waldstein from my favorite beaver pond. Have a great day.